To me, it's all about being on the same team as the person I'm working with. And the team is me and the patient. I see my role as a physician trying to find what an individual patient's goals are to be one of the most important things that I do. My father was a cardiologist, and I learned a lot from him, seeing all the different sort of studies that were read and everything along those lines. But the other thing that probably drove me to this field is while I was in college, I had a friend who had congenital heart disease, and I saw a medical encounter that they had that was, in reality, in my knowledge now, a quite simple situation. But because of the confusion that surrounded her congenital heart disease, became a very complex situation. And I saw a role for myself there in trying to make sure that those patients who have complex histories have the best information and directions forward. The simplest answer for what congenital heart disease is broadly is they are heart conditions that a patient is born with. I diagnose some of them in people who are in their 90s. And then there are those that barely get out of the first few days of life and they need open heart surgery. So it's really a pretty wide spectrum. I will sometimes see patients who have holes in their heart when they're born, but they've actually closed over the course of their childhood. But I do have a lot of patients who have holes in their heart that have been addressed in childhood or newly discovered in adulthood, and any number of issues that can happen with the walls or the valves. We see patients who are probably the most unique when it comes to their hearts. Every patient deserves their own individual plan. A lot of my patients come to me with a lot of questions. A lot of my patients are young women. They want to have families. They've been told they can never get pregnant. I have a lot of interactions where I tell them that they can, and it's life-changing for them. If I could give a patient something or an impression, it would be that I feel like I have an understanding of what's going on. I feel like this person knows what's going on. And I feel like we can build a high quality of life together moving forward.